Anatomy and Physiology. Week 3. You're halfway done. So what does that mean? We have the midterm coming up this week. With this one here in medical terminology, we're going to go through the whole week 3, the modules, the to-do list, and all that kind of stuff. That way you're set up and ready for the midterm, which is 50 points. You only get one attempt at it, so make sure you have your stuff set up for you, okay? Discussion post, remember, is your initial discussion post is due on Wednesday, and then the follow-up responses to other students are due on Sunday. Online, they see the gradable class case studies 9.3, 10.2, and 16.2 is due on Sunday, and the midterm is also due on Sunday. So that's this week, man. So let's get that all going. Halfway through, you guys have made it. So we have 3 chapters we're going to be dealing with: the blood, lymphatic, and immune system, section 1, 2, and 3, cardiovascular system, and oncology. Oncology is actually the study of cancer. So I'm not going to go through this stuff right now. I want to go through a little bit extra. I'm going to go through those in different sections, which you'll see. You look at the other parts of the playlist, you should be able to see those. That's your reading anyway, chapter 9, chapter 10, and chapter, what was it, chapter 16. So as we go through, I'm on PET scan. So we're talking about week 3 discussion, PET scan. A PET scan, or as you hear, I want you to look up the word PET scan, and make sure you use that, the entire thing, in your discussion board. So have a definition of what it is, and that's what they're going to ask here, right? Identify what a PET scan is and how it is used. 3 different conditions a PET scan is used for, and how, if applicable, it would help the patient, okay, and respond to 2 others. So a PET scan doesn't mean like having a Labrador come in and you get a lab test, or having a cat come in and you get a CAT scan. That's not quite it. PET's a little bit more specific, and it's very good for lighting up some things that may be wrong with the body, and it'll show you how as you read through and look at those. You can get the rubric. Remember, if you're looking at the PET scan, week 3 discussion, move some stuff over here. Sorry, that's my teacup. You're going to look over here. We're going to see week 3 discussion, PET scan, and over here you're going to see 3 little dots. That's where you can click and you can get the entire rubric for this thing, and it'll tell you exactly what I'm getting you guys set up on. Wow, so many people have already answered it. This is really good. Very proud of you. What do you do in the structure section? There we go. Continue with this stuff. Case studies 9.3, 10.2, and 16.2. So when you're doing your discussions, don't forget to use a couple sentences to respond to others. You can talk with each other and stuff like that, but make sure you're talking about the subject at hand and you're adding to it. So maybe some other way that something else that you saw. Let's look at the graded quiz, case study 9.3. Annabella is spending part of her afternoon working in a blood drive team in a hospital gymnasium. When she arrives at her station, she notices pink vials, something that she does not often see. From her training, she remembers the pink color is particular for blood banks and makes these samples stand out. These vials signify testing for blood type, Rh factor, and antibodies, among other tests. Her first donor, Jaden, is a 20-year-old student from a local college. She greets him and asks if he has donated before. No, this is my first time. She says, will you find out my blood type today? Tells him that he can expect to receive a card in the mail with his blood type noted, but first she needs to review some information with him. Have you ever had a blood transfusion with other than your own blood? He says no. What about tattoos? And shows a dragon on his upper arm. Just got it last month. I'm sorry, she says, but you must wait 12 months after getting a tattoo to donate blood in states that do not regulate tattoo facilities. So you get to take the review, preview, whatever it is, of the quiz. So let's look at this one here. A transfusion is using an individual's own previously drawn blood is called an, so you get to look at these ones. Not a refusion, obviously, it's not anastosis. So you can go through and look those up. Best thing to do is to look these words up, write them down real quick, the 4 choices that are in there, and then that way you can look those up and come back to the question. You have some time to do this. It's like, it doesn't say how much time really, does it? Just a few minutes. Blood O, see O, what type contains what kind of antigen, what kind of antigens and antibodies. RH factor talks about, and what's the universal recipient? So remember, the universal donor is O. Universal recipient is going to be AB. Okay, that means it should receive from everybody. Don't really worry at that point about the positive and negative, the RH factor, which is the rhesus factor. You guys will be able to get that at another time. It'll talk about that later anyway. The next case study, what is this one? Vernon, he's retired. Oh, looks at the next patient. While he's being seen today, he says he bumped his legs on a chair 3 weeks ago. It still hurts. Cramp-like pain in the lower legs over the last 7 months. Yesterday's is swollen, and he has varicose veins. Oh no, he needs sonography. Okay. Okay, so remember, it says the first question here is, what is the term for swelling of the extremities? The extremities are the periphery, right? We have the axillary part of the body. That's going to be the torso, the head, and stuff like that. And then the peripheral areas are going to be the legs and the arms, okay? Edema is swelling, claudication. Ooh, I like that one. But that's a different kind of thing. You're going to have to look up dependent and intermittent claudication for those. Raynaud's disease is very specific. What is the term for cramp-like pains in the calf muscle exercise? Well, that's not, okay, that's intermittent claudication. That's where we go. Okay, varicose veins occur because of the valves. So remember, the veins are always going back to the heart. In order for them to get back to the heart, we don't have enough power with our heart to push stuff all the way down there and all the way back. So what happens is, as we move and as we change position and as our heart does pump, it can move that a little bit up. And if it's moving along that tube, which is the vein, and it has a backflow valve, that valve can close and let a little bit up and then let it fall back down. Close a little bit up and let it fall back down. Those valves will collapse or close. If they do collapse this way, they become varicose veins. Phlegbo means vessel, of course. And there we go. So pretty good. Easy one on that one. I think you guys will do just fine. Let's look up the third one. This is Mark Sampson. Cancer registry. I'm just reading through my stuff real quick. I'm looking there. It means the development. Neoplasm. Not oncology. Oncology is the study. Right? So these are pretty easy. You can go through these. I want you to go through, and if you can see each of the questions all at once, write down all the answers and get a real quick definition on those. That way you will know everything in this, and it's going to propel you in your knowledge of what's it called, terminology, way better. I mean, you're going to be able to really get through this, no problem. Last part here, where we go in the case study, we did that one. Okay, and I'm just plugging along in through here, trying to get everything. Hopefully we're still okay. Sorry about that. My computer like shut down because I hit the wrong button or something. Midterm, 50 questions, 1 time to take it, right? The answers are, as soon as you answer it, it locks it, so you can't even go back to them. I'm not really liking that, but that's the way it is on this. Keep your notes with you. Take your time doing it. You have a good 100 minutes, I think it is, to do the test, and get it done as soon as you can. Late work can get you in some trouble, and we're halfway between. If you're having problems, get in contact with me, and also get in contact with your hybrid coordinator, and they will help you. Anyway, this is Dr. Sean at my office, at my desk, whatever, in front of the camera, working for you guys. Let me know how it goes. Don't forget discussion board, quiz, all that stuff. Still do. Well, there's no quiz. It's actually case studies, and then you have the midterm. Good luck on the midterm, guys. We'll talk to you soon. Bye.